Awesome. Thank you. Representative Schmaltz?
Thank you for your testimony, and I appreciate everything social workers do. They deal with our most vulnerable citizens, and so I have the same concerns that I had last time when we heard testimony. Quantity over quality, again, you deal with our most vulnerable citizens. So my question is, you're taking away supervision, you're taking away testing, supervision hours, you're taking away testing. How is that going to help? And you said, well, you have anxiety and depression over taking this test. How is that biased toward one section of the population or the other?
Go ahead.
Yeah. So when we're moving from 4,000 hours to 3,000 hours, although yes, it is a reduction, we are also more in line with what we see in other states throughout the country. So we are, I think we have the most required hours of supervision. So we are just simply matching what our other neighboring states and the kind of norm throughout the country in terms of supervision hours. I know that I said this last time we got to be in front of you, and I will say it again, that taking the test that is before, that folks have to take now, because they can pass that, does not make them a good clinician. That is not like, this is not a one-for-one. I know plenty of good clinicians who struggle with the exam, and so the exam that we're suggesting is an exam of the existing laws around social work that will then guide folks in terms of that practice of social work. That is the exam that we're seeking to change to. The clinical parts that folks learn, they learn that through their schools, which need to be accredited. So the education that folks get and the supervision that they receive, both individual and when you finish your supervision officially, I can still say, even after practicing for 30 years, I still do supervision with other psychologists around cases, right? And so that never, and I don't believe for clinicians that ever really ends. It officially, I don't count those hours, but we're constantly learning and wanting to be as, frankly, as good as we can be for our clients.
Again, I don't see where the bias comes in, but I'm wondering, why can't you, when you take the test, if there's a certain portion that you don't pass, that you just take that portion
Sure.
again?
Do you want to take
Yeah,
that? Yep.
yeah, that's a great suggestion, and it's one
is.
that our national organizations have provided to the board or the association that writes the social work exam. So when the disparity data came out, there was what we thought a fairly common sense group of suggestions that were provided, which include, could we look at just taking modules? So if people are struggling with one particular section, could they go back to that? Could we look at reducing repeat test fees? So if people are taking the exam 10, 12, sometimes 20 times at $260, that's $10,000, $15,000 that's coming out of a social worker's pocket, which is a lot of money for anybody.
Well, I also heard that they were offering some scholarships for this, and that's something that possibly we could look into so you didn't have to pay each time.
Yeah, that has started. There's been a little bit of work towards that. The other suggestions now in 2021, it was required that all the states, you had to have all of your supervision hours complete before you sit for the exam. We would like to see that removed so people could take their examination as soon as they get their initial licensing level. We do not, and from my experience with the exam, believe that the exam gets easier the longer you're in the profession and further away from your basic education. It actually gets much more difficult. And so we think that that's also a reasonable solution. Providing free test materials for folks to study. And so those reasonable suggestions haven't happened yet, and it's been almost 2 years at this point, and so it's been very frustrating for the larger social work community as we see it in action.
I'm sorry, we've got to move on. Thank you. Representative Reingens?
May I answer her question too, just really quickly?
Yep.
This is copying what other states have done. It's not removing the hours. It's only subtracting 1,000 hours just to take the examination, not in order to do your job. We still do supervision after we have our license, so it's not saying that once you get your 3,000 hours, you're done. It's not saying that. And I also encourage everyone with a smartphone to Google how this exam is racially biased, because you will see it across every state, how more African Americans are not able to pass the examination. People have said to black people, you should think like a white woman if you want to pass this exam. That's some bull crap. So I encourage everyone to take out their smartphones and Google it, because you will find a lot of information on why this examination is racially biased.